tell me name Oda TV?
Well, me na Dr. Mustapha Kabba. I mean, the Deputy Chief Medical Officer, Clinical Services, Ministry of Health.
Okay, so start for everybody purpose for this meeting today.
Well, this meeting we hold as an interministerial meeting for talk about the upcoming 64th scientific annual meeting for the West African College of Surgeons. The West African College of Surgeons are a very big institution. We're responsible for trained surgeons within the sub-region, and they don't do this over so many years. What they can do is that every year then they get an annual conference within the whole. Now one English or a French country, and this time Sierra Leone, luckily, now we're fortunate enough for make we host them. It's a very big event for the country. So we get a kind of big national event. It's good for make you bring all the ministries, departments, and agencies that we're responsible for make sure say this event successful.
Okay, so this now is 64th conference with the owner salon. So when this conference they start? The
conference they start on the 3rd of March and it end on the 7th of March.
So for people we're going to listen this interview go on now, what are some of the different things that we want to talk about during this conference?
Well, before I start by the conference itself, there's always for this kind of conference a pre-conference activity where they start. We don't start this Monday, right to Friday, meaning we get surgeons them from all over the West African sub-region where they can do free surgery on patients in our country, like places like Bo, like Kenema, Makeni, Kono, and even Freetown, and highly specialized surgery they need to. So this is one of the activities that where this conference can bring our country, so that they take care of the vulnerable people. Then the conference itself, you look at the annual conference for the West African College of Surgeons for look at the agenda, set up a new executive, look at issues coming up within the year where they need for address as a college. Then scientific papers will be presented, publications, research within the West African sub-region, where surgeons they don't do that in different hospitals and in countries. They get for presenter. And luckily this time around, my salon with the host them. And a lot of these presentations they come from Sierra Leoneans that we don't do good work in this country for presenting cases.
Okay, so Salon the host this year conference, how prepared the country?
Well, the country is well prepared. We get today, you see the high level of representation we'll get from all the different ministries, foreign affairs, because then people they need foreign protocol, they get for come through the airports, they get for the hotels. So you see foreign affairs, you get internal affairs, you get even the police were there, you get office of the president who has been very supportive to this entire activity. The Ministry of Health definitely is taking the lead in this. So the preparedness is at a high level. So we hope that on that day, or the days for the conference, everything will go on well as planned.
Okay, so now how many surgeons are there for that country?
Well, we are expecting between 500 to 600 surgeons. These are not just, these are highly qualified people, highly selected from their various institutions within the Canada's country.
So earlier on you be mentioned say they get for do different surgery there. What is that surgery they need there now if not free?
Well, the surgeries that I can start with the last question are free. And the surgery the way that they do that, they start from general surgery, then they look at this thing we can call gegen our throat, then they operate on a thyroid, then they look at them picking away can get out what they call hydrocephalus, that big head. Then that one they can get a neurological problem and then master and then back. We get neurosurgeons and the way they currently in Freetown hospital for doing surgery there. We get urology, then man we get prostate problem, yeah. We get plastic surgeons, there. We get eye surgeons. And so it range from a very vast range of surgeries that we do, and these are highly specialized people where they do the complex surgeries that sometimes in this self not able to do that inside there.
Okay, so one way they still go and benefits from them different surgery and the way you don't mention. What are the different places that we then go for benefits from that?
Well, this outreach activity already start. And the West African College of Surgeons, because they get limited capacity for all of this, then conduct and with support from the Ministry of Health, they already conduct the screening at the district level. So the surgeries they already go on Kenema, Kono, Freetown here at Freetown Hospital and McKinney Hospital.
Okay, thank you very much.
You're welcome.